What we're looking at really is baby boomers that are heading into their later years with possibly dental problems that are not addressed by what's available now with Medicare, dental insurance, and the Affordable Care Act. That's the issue that I'm kind of looking at. And I'm just trying to raise some questions here. And I just saw an article in a dental journal that's doing the same thing that came out yesterday, as a matter of fact. And what that was looking at, and what I'm looking at, is the fact that Medicare, good or bad, right now the government, and we pay for that, is covering health care for later years. And what's not included is adult care for dentistry, optometry, and hearing. And what I believe is that those three areas, and I know a lot about dentistry, that could affect the entire body. So I don't think it's right to pay for one area of the body when another area of the body is affecting it. I think that should be at least looked at. And that's what I'm trying to kind of bring points on here.
Well, good for you. I think it's a great issue to bring up. I've often wondered about it, and I feel for everyone who has some expensive dental care, and that does occur as you get older, because it's, in many cases, an unexpected expense.
Well, one of the things I'm recommending is that people meet with their financial planners in earlier years, because dentistry, in general has an end life. So a dentist does a bridge or a crown or fillings, there's a point where they're not going to be serviceable. And the problem is when people hit their later years, they have more of a fixed income. Now they don't have coverage. And this is something that people should be really planning for.
So what have you, in your work in this area, do you see some kind of hope, or are you optimistic that something can be found?
Well, let me just tell one quick story. My parents are in their 80s, mm-hmm. and in the last 5 years, I have done dental work on them, which probably would have come to around maybe $60,000 or $70,000 because I've done dental implants on them. If their son wasn't a dentist, they would probably not be able to afford that. And I know they're not the only ones out there with that condition, because a lot of times there's a lot of dental work that's kind of breaking down. And then we're in the process of writing a book right now called Teeth Tomorrow, the dental turning point for baby boomers, to really shed light on the different options that are available. With all the press in the news lately with the Affordable Care Act and the revisions on that, I think that now might be a tough time for this whole topic to be brought up, but I believe it's in motion on a lot of levels from these different medical areas.
And two, when you have some kind of an abscess or tooth problem, an infection, those can become very serious, right?
Absolutely. I mean, that could be life-threatening. But in general, gum disease, for instance, when someone has bacteria in their mouth, there is elevated C-reactive proteins and different things in the blood that affect the entire body. So if someone's going to be covered for general health, and now we could see a cause for that, it just seems to make sense to me that should have some kind of entity of coverage, just from a face value standpoint.
That the kind of procedure you just described, I hate to think of what the cost of that is.
I could tell you the cost. I mean, generally when you're looking at replacing one arch of teeth with dental implants, and there's different ways to do that, you could spend up to around $30,000 for one arch, and that would be $60,000 for the entire mouth. But I like to, from the trenches, inform people of what's going on.
So let's just touch upon that a little bit. For those of us who maybe haven't addressed it in the way that you've described, because as you alluded to, we go to the financial planner and we plan ahead and everything. What kind of steps might we take for our dental health going forward?
I think it's a matter of apportioning funds for the future if needed. And that really starts with a comprehensive dental examination. But I've never seen an insurance plan or any kind of plan that could cover such a large expense if that were needed.
Okay, so I see your point then. Really make this as part of your long-term planning financially.
Absolutely. Yeah. It's a reality that has to be addressed, and the earlier the better, just like people plan for other areas of their life later on in life earlier on.
Oh, great. Well, listen, as we wind down here a little bit, for folks who are in the same situation. Maybe they haven't planned. Hopefully they have. But what might be some takeaways that folks can learn from here?
Well, I think other than starting with a consultation to really assess where they're at, looking at the future, oftentimes smaller procedures can be done to avoid larger problems later on. But some of the resources for financing this, which can be discussed with a financial planner, for instance, there's financing options available from different companies that can help pay for this. I know patients have used second mortgages, and home equity loans is another resource. So there's different avenues for this, but from what I've seen, I have not seen an insurance company or any other type of that situation that really could address this. So I think it involves some diligence on the patient's standpoint.
Well, very good. And for folks who maybe want to follow you a little closer, or maybe they have some suggestions or ideas on all of this, what's the best way to get in touch with you?
Sure. I mean, teethtomorrow.com is my company other than my dental practice. And teethtomorrow.com has some good information on this whole realm. I'd be glad to give out my website is tischlerdental.com, Tischler dental.com. And I can be contacted through there. But I'd be glad to help anybody with this vision for the future.
Thanks so much. That's Dr. Michael Tischler. The impact that healthcare and minimized care of baby boomers has on dental and health insurance overall. Thanks, Dr. Tischler. We'll be right back.
Thank you.
Well, I hope you liked the show and I learned a thing or two. The full show will be available on YouTube and at BloomerBoomer. The audio version will be available on Apple Podcasts, and we have other shows coming up with some amazing guests. Please like us on Facebook and visit us at bloomerboomer.com. Until next time, so long.